Early warning signs of knee arthritis include symptoms such as swelling of the knee, of pain, of giving way, loss of function, so difficulty with walking, getting up from a sitting position, difficulty with gardening, difficulty with kneeling. Sometimes patients complain of stiffness. And so these are often the early warning signs that the knee can be arthritic. So patients who have previously had a significant injury to their knee, such as a ligament injury, or if they had previous surgery to the knee, have a higher risk of knee arthritis. Patients who have an underlying arthritic condition, such as inflammatory arthritis, such as rheumatoid arthritis or psoriatic arthritis, or have a history of gout, also are at higher risk of having knee wear and tear arthritis, which is osteoarthritis. For patients who are large, who are heavily overweight, are also at increased risk of arthritis. And then patients who have a strong genetic history, so if their parents had knee replacements at a young age, they have a higher risk of requiring or having knee arthritis and then requiring a knee surgery also at a younger age. And I think if the pain and swelling, the symptoms aren't settling within a few weeks of developing those symptoms, if it's significantly affecting your quality of life and simple analgesia is not effective at settling the symptoms, and I think it's important to see a healthcare professional about your symptoms to get it checked out. A lot of patients worry about making the pain worse and whether that would then make their arthritis worse. In fact, for patients who have known osteoarthritis of their knee, then regular activity is actually beneficial from a pain relieving point of view. So it's important to carry on staying active. Sometimes patients need to just choose their activities, perhaps particularly if they're doing a lot of gym exercises or heavy lifting, to try and work on more low impact activities such as cycling or swimming, regular walking. Some patients get a lot of benefit also from taking nutritional supplements for their arthritis, such as glucosamine or chondroitin sulfate or turmeric, and so patients find that helpful. So trying to modify activities, and then also just trying to control weight for those patients who are overweight, that also can significantly help settle down the knee pain. It's really on an individual basis. So I think really you need to see how it's affecting the patient, try simple measures such as analgesia, modifying activity. But it depends really on the patient's expectations, on the amount of level of pain, and if you get to a point where actually you can't manage the symptoms with simple treatments, then really being seen by a healthcare professional is probably the most useful next step to try and then look at other means of helping to manage the symptoms, whether that's from medication, whether that's trying steroid injection, whether that's trying physiotherapy, or actually needing to see an orthopaedic specialist to look at surgical options.